Hi, everyone. First, I want to check if you can all hear me well. And to welcome you in the IATI Publishing and Data Access Guidance on COVID-19 webinar. Thank you very much for promptly joining at the starting time. And first of all, I really want to say that I hope you're all doing well, and thank you very much for dedicating time to join the Publishing and Data Guidance webinar on COVID-19. So my name is Petya Kangalova, and I'm a representative of the IATI technical team. And today I'm joined also by Sarah McDuff from UNDP, and she would also be presenting today. Very much wanted to start and say that, as I'm sure most of you, we're all working the IATI Secretariat and tech team, and all of us are working remotely. So do bear with us as we're all in different locations and all that. A bit about Zoom and how this webinar is going to run. First of all, we'll mute everyone by default just to make sure that you can all hear me well and there is no other background noise. We will be recording this webinar, so you have a chance to hear again that recording, and we can share that more widely. And we aim for the webinar to last an hour. There will be plenty of time for you to contribute as well, and time for question and answer. And before I begin, I just wanted to say that I know this is our second webinar. Some of you have probably joined the first round of webinars that we did at the beginning of the month. So thank you again for taking the time and joining us again. So moving on to the next slide, I just want to first of all run through and explain what we're going to do today and what the agenda is for today. So I will start with a brief introduction about the role of IATI and kind of highlight a few of the importance of transparency and what IATI's role is, and what progress we have made today. So since the first webinar we did at the beginning of the month, what has happened, what has changed, and what's the added value of you joining this webinar. So then we're going to go into the more detailed guidance. First of all, the overview of the updated publishing guidance. I'll be going through what we heard back during the consultation in April, and I'll highlight the additional recommendations. And then Sarah will go through an overview of the data access guidance. So going through the different ways in which you can access COVID-19 in IATI tools. And then we have some time about some further considerations and some questions and discussions that also came during the consultations, and any questions that you might have. And then I'll go briefly through the next steps in this process. Great. So first of all, what I wanted to really highlight again, and I'm sure most of you would have heard this so far, but it's just highlighting what role IATI is playing during COVID-19. So talking about the importance of transparency during the COVID-19 pandemic, and what we want to do as a secretariat and tech team and within the communities to ensure that we support our publishers to share data on their spending and activities to address the pandemic, but also users to access the data. So it's really important that with open data, or by publishing IATI data, you will be providing partners with better information to plan, coordinate, and evaluate the response to the pandemic. Again, I think it's important to highlight that in IATI, and it is important to recognize the contribution that both the international, humanitarian, and development actors play in that response, and looking at both the immediate but also the long-term recovery from the pandemic. So it is our call to both development and humanitarian organizations to provide that information. And last but not least, I do encourage, and we already had great involvement from the community, but we do encourage you to work with Secretariat and Tech team in the coming weeks and months as well, and to kind of continue this process to work together and work towards that improved publication and also data access and data use, and go through those topics in more detail as well. Great. So going on, what I wanted to highlight to those of you, those who have now joined this webinar, but also participated so far, is just to understand what the progress has happened since March. So what we did as a Secretariat, and a very fast response in terms of publishing guidance, how organizations are introducing the IATI publishing guidance at the end of March, which was available on our website. And that was very much done in response with conversations with other reporting standards and working together with FTS and World Health Organizations and others. Since then, we run a number of webinars and we had very good participation, and as a Secretariat and Tech team, we very much welcome those contributions from people. So through the webinars and also consultations we held on our main forum on IATI Discuss throughout April, we've gathered that feedback on that initial publishing guidance. And this webinar is very much looking at that updated publishing guidance and going through an introduction of the data access guidance, or how you can use IATI tools to be able to access that data. Great. So what I wanted to start and go through is just a recognition of what we have so far in the IATI guidance, who the guidance is for, and that hasn't changed. So the IATI publishing guidance is very much for existing and new publishers. So all those of you who are already publishing a lot of data, the guidance will provide you with information of which elements to use and how to provide data on COVID-19. But also for anyone new joining the community, and the number of IATI publishers should also be following this guidance. And again, reiterating what I already said a bit earlier, is about both development and humanitarian organizations, and ensuring that we are meeting the needs of both development and humanitarian organizations. So going now into the details of the guidance, I think the starting point of what I wanted to talk through this, and going into the details of the elements, is there's been no objection to our current guidance of what we've announced at the end of March. And I think here is the time to very much thank everyone who joined our previous webinars and really actively got involved in Discuss and fed back. And we really, really welcome your contributions and suggestions, and that's been extremely beneficial to be able to provide that update. So going into the details, on this slide, what you can see, and the highlighted in yellow bit, is the additional recommendations that came out of the consultation that took place in April. So going through each one of the elements. So first of all, we've already advised organizations to use and to add COVID-19 in their titles. The addition to include description has very much been made, as some organizations said that they weren't able to follow that guidance and just add to the title. So that very much gives an option to those who are unable to do that, to also use activity descriptions or transaction descriptions, and some of the considerations will go in more detail about the use of transaction descriptions. But very much here we're flagging that, that additional recommendation options for those who are unable to use or to add COVID-19 in their titles. Then in terms of the use of humanitarian scope, that very much does stay in place, and I'm aware that some organizations are already using the humanitarian scope element. So the recommendation here is very much to link to both the emergency and appeal and the associated codes that you can see on this slide. It's important again for those 2 points on title descriptions and humanitarian scope is that recommendation is to use for both development and humanitarian activities. Then moving on into the use of the humanitarian flag. The humanitarian flag, this is again a standard recommendation for activities or transactions that are classified as humanitarian. So if any COVID-19 activities or transactions are coming from a humanitarian related area, then we would advise to use those flags. And last but not least, what I wanted to focus on is the additional recommendation on the use of the tag element for development activities. This is quite important because this very much came from the consultation, and it is only to be used if your organization doesn't permit the publishing of data in the humanitarian scope for development activities. So this suggestion came very much from development actors, where they did have challenges or specified challenges of using humanitarian scope for development activities related to COVID-19. So this recommendation was added there. So very much we've included that to, we've taken this approach to ensure that the publishing guidance doesn't prevent COVID-19 activities from some development organizations being published. I'll also flag that here there were a number of suggestions, again, thanking people in the community who were involved in this consultation, and we haven't yet responded on why the suggestion of using the tag element with vocabulary 99 and just specifying the code in the code like a free text with COVID-19 is the simplest way to allow that, but also not to add multiple layers of complexity within the IATI standard. So in simple terms, those are the kind of 4 areas that you can see in the IATI updated publishing guidance that's now available on our website. And you can see again the updates flagged in yellow in the updated guidance. So please do at the end of this webinar ask any questions specifically around the publishing guidance. So moving on to our next slide is again highlighting the importance on not purely the COVID-19 elements that I just talked about, and in the previous webinar, I already talked about some of those areas, but that's really, really important from a data user for the data to be useful, to really reiterate again those areas on timely, comprehensive data and data that's linked within different activities. So first of all, on the timeliness of data, I think during the consultations, there was also quite a bit of feedback on that, the recognition that data needs to be published related to COVID-19 as soon as possible, but also to be updated regularly, with also some comments around, data users suggestions on requiring weekly updates also. Comprehensiveness of the data, again, importance of having detailed titles and descriptions, geographic information, location, results data, and very much all these fields that would help you to describe your work. And last but not least, very much thinking about the coordination that we just talked about, not just between development and humanitarian activities, but linking those reported activities is another important area on being able to provide that information in a very useful way. I'll now move on and hand over to Sarah to go through some of the points about accessing IATI data on COVID-19. So you heard already quite a bit about the direction and the recommendations on publishing and elements, but now Sarah will go through how you can access IATI data following those recommendations. Over to you, Sarah.
Hi everyone, sorry about that. I was waiting to be unmuted there. So thank you, Petya. So I will go through a little bit about how it's possible to access COVID-19 related activities in the various tools, and some things to keep in mind when doing that, and also some things to keep in mind when analyzing this particular data. So first, it's possible to access COVID-19 data in all three tools. Through the Data Store API, in dPortal, and in the Data Store Query Builder. But in accessing data, it's important to kind of keep in mind that, of course, as Petya has just gone through, there are various different ways in which publishers could be publishing this data within an activity. And so it's important to remember that in order to get all activities that are, COVID-19 related activities, you need to be able to search for all of what I will call COVID-19 classifiers within IATI data. So right now, like the Data Store API allows you to search for all of these. dPortal allows for searching of most, and the Data Store Query Builder allows for searching of a couple, and I will go through each of those in more detail as I go through each of the tools. So we can move on to dPortal. So in dPortal, last week there are two primary ways to find COVID-19 related activities. And the first is that a new button was launched at the beginning of last week, which you can see here in the screenshot, which allows you to search quite easily for COVID-19 related activities. So obviously this button is on the home page. You can navigate to the home page and click on it, and it will search for COVID-19 if it's included in the activity title and the activity description, and it also searches for the COVID-19 specific codes that are reported in the humanitarian scope element. It does not currently search for the code in the tag element, which is part of the new guidance that Petya mentioned, but I believe that there are some, they're exploring how to potentially include that, and so hopefully that can be updated relatively soon, so it's possible to search for all of those. So one thing to keep in mind when using the COVID-19 search button is that when you click on the button, it will give you all of the activities. If you want to further refine this search, you just need to click on Refine Search and then add the relevant filters, which then allow you to look at COVID-19 related activities by country, recipient country, or by provider, or the various other filters that are available on dPortal. But that sequencing is important, to click on the button and then refine the search. The other way to search on dPortal is by using the free text search box, of course. So the button just searches for activities that use COVID-19 in the specific way it's referenced on the slide. But if you wanted to search, you know, coronavirus or other different terms, then this is possible through the free text search box. So like, just to give one example, I won't go through the demo in this presentation, but if you wanted to search for COVID-19 related activities that had a recipient country of Nigeria, you would click on the best way to do that would be to click on the button, find the search, select the recipient country, and then it will give you the subset of activities in which Nigeria is listed as the recipient country. So obviously the advantages of doing this on dPortal is that it's quite easy, especially with the button. And it kind of quickly gives you a list of activities, and you can dive into each of those activities by clicking on them and looking at all of the pieces of information about those activities. But one of the disadvantages with dPortal, of course, just generally, is that you can't access all of the data fields that might be associated with a particular activity. But this is possible in the data store query builder, which is I will move to next. So to search for COVID-19 data in the query builder, there's a couple of different options. The first, probably most useful option is to search in the free text search box. So this does allow you to search if there's a COVID-19 classifier in the activity title or in the activity description. And so obviously by using the query builder, you have the ability to search for these activities, but then also have a lot of different, a lot more data returned to you on these particular activities. So that's probably the searching in the free text box that will give you obviously a subset of the COVID-19 related activities, because it's only searching these two classifiers, but that's probably the best way to do it. And it's also just important to remember when searching the query builder that it functions as an and. So when you search for various different things. So if you search for, it's important to remember that it will, if you search in COVID-19 in the search box and then you choose a particular filter, it's going to return only the activities that meet both of those criteria. So the second option is kind of a little bit of a workaround at the moment to get you activities that have the COVID specific codes and the humanitarian scope elements, but you can filter the activities using in the additional filters tab. You can add a filter and add humanitarian scope. And then you can select all of the activities that have either an appeal or emergency, have the appeal or emergency fields populated. And then once you get the CSV export, then you can filter within the CSV for the COVID-19 specific codes. So it's a bit more complicated, but also an option. So I will move next to the final, which is the data store API. So as I mentioned before, this obviously allows you to query all of the different COVID-19 classifiers. And so we'll give you the fullest set as sort of the easiest way to access all of the activities that are using these classifiers. And just to give one example, there is this dashboard that you can see on the screen is currently under development through the Grand Bargain work developed by Mark Bruff. And it is currently using the data store API to access COVID-19 related activity. And so this, obviously the dashboard is currently still under development. And it will pick up any of these classifiers, but of course, it will only pick them up if they're published. So again, like there's already work, just to highlight, there's already work underway to create visualizations and try and showcase this data. But of course, it's important for publishers to do their best to publish this information in order to make this information accessible to users. Which kind of leads me to my next slide, which is on analyzing this data. So clearly, what data is published and how it's published has implications for what data can be accessed and how it can be used and analyzed. So it's important to kind of consider like how the current publishing guidance translates not only into like how you can access the information, but then potentially how you can analyze it. And then potentially what do we need to consider or what conversations do we need to have about how the information continues to be published going forward. So just to kind of highlight what's currently possible, obviously, you can identify COVID-19 related activities in IATI data. If publishers are publishing one of these 5 different COVID-19 classifiers. So in terms of data use, what this means is that you can analyze the countries receiving funding, who's funding these activities. So it's certainly helpful, for coordination purposes, to help, potentially funding organizations or implementers to know the other activities that are being directed towards COVID-19, particular countries or regions. And so it could be used to support coordination efforts. But it is not yet possible, based on how the data is currently published, to sort of analyze financial data. And I think that, Petya will talk a little bit more about this, and certainly this has come up through the consultations and in the past webinar, but just that it just can't be assumed that if a COVID-19 classifier is used, that this means that 100% of the resources under that activity are being allocated to COVID-19. And so it limits the analysis that can be done in terms of financial data, unless you sort of dive individually into each activity and kind of analyze one by one what it looks like in terms of what's going on in that activity. It's also important to kind of highlight and this isn't just only in the context of COVID-19, but also just double counting is an ongoing challenge, just making sure it's often difficult to tell whether there are resources that are double counted, reported by multiple organizations. So again, doing some aggregated financial analysis can be a bit challenging due to that issue. This kind of highlights, like, in terms of what analysis is possible. So it can help to kind of help us to think about what we want to do going forward, and how, if this is important to enable the use of the data, then what needs to happen on the publishing side to sort of make that possible. So at this point, I will hand back over to Petya to kind of dive into some of these questions.
Great, thanks, Sarah. So I'll move on to a few questions and considerations, and then I think we'll have plenty of time to hear from you. So in this webinar so far, you've heard from me around the recommendations and the advice, the dated guidance we are providing for you in terms of publishing, how currently you can access it. That's what Sarah talked to. But there's still quite some questions that came through the consultations where it will be really good, and I think feedback very much from the community as well, that you'll take some time. So those are questions we would like to continue the conversation with you on Discuss, on IATI Discuss, and they're the kind of more detailed areas where Sarah briefly referred to about how you capture spend and so forth. So just run through those 3 questions and some of the suggestions as well that we are offering, but it'll be good to hear from you on those, and we'll pose as well for any questions that you had during this presentation, because I think we provided quite a bit of content. So running through the first question that came about is around quantifying percentage of funds allocated for an activity to COVID-19, and how we tell how much of that activity is being budgeted, committed, and spent on COVID-19. So here we really want to hear from organizations of how currently the allocations work. At the moment in IATI, there are options and then some suggestions on how that can be done in terms of using COVID-19 in transaction narratives, or there were some suggestions on the use of the sector element where you can assign percentage. To be able to advise on that, it would be really good to hear currently how you do that in your organization. Then the second one is around diverted and repurposed funds due to COVID-19. I think that's something that's recurrently coming as the questions, and how those changes should be reflected in IATI data in terms of activities and transactions and how those are identified. Again, in terms of the technical side and options of how that can happen, there are some suggestions we've already added and discussed in terms of whether you could cancel, so split activities, create new ones, create two activities. Potentially, you could also do like removal of funds of existing activities. So again, the kind of technical option and solution is there are quite a few options, and it will be good to hear from you on that. And last but not least is very much the question that links to the recommendations we're providing. The data use question that not just us, we have been asking, but very much we heard those questions from the community. And whether the analyzing and the recommendations we are now focusing and are actually responding to, you know, the long-term effects of the pandemic, and whether those needs will be different, or whether they will be changed to what is required now. I don't anticipate we'll answer those questions now, and I think on those ones we would like to keep the conversation with the community. But we do have now half an hour to hear from you on those questions, or if you have any other points or feedback on what we have presented so far. So if anyone wants to join in, if you can use the you can raise your hand on Zoom, and then we'll ask you to speak and feed back to us. And if we ask you just to say your name and which organization you're representing, that will be most welcome. And you can also use the chat box if you prefer that. Great, so let me see. If you have any comments or questions, great, we have. Hi, Julian. I can see you have your hand raised. I'll just unmute you. No.
Okay, so yeah, sorry, I wasn't able to unmute. This is Julian Dianquin from Development Gateway.
Yeah.
We are working, well, we have a tool that imports IATI data into our AMS, and we were analyzing, we are building, and we were the adjustment to the tool to import data. And talking about further considerations, we wanted to raise that we see that, like, since there are several ways of tagging an activity that might be related to COVID, we don't see a clear path to a system to determine whether it should look at the description. And even though if it's like it's free text, we see that we rely a lot on human intervention from the publishers. And also we see that's very complex, what you said before, that we see very complex having all these type of ways of saying this is COVID related, how to properly track which funds are allocated to the pandemic. Yeah, that's it. That's what we wanted to say. If we can find a way of like leaning towards only one recommendation, so it's easier to consume this data.
Yeah, thank you, Julian, on this. And I think it's great to hear from you, and that you are using and importing IATI data in AIMS, and this feedback is really useful. And I know there has been already some comments with what you're saying about having a clear path. I think this is what we have tried to doing, is very much with the recommendation, suggesting the titles and descriptions, and very much for both suggesting the humanitarian scope. Obviously, you would have some scenarios where, for instance, development organizations not being permitted to do that. So I think we did try to strike that balance of, not stopping somebody from publishing because they cannot use a specific element. I'm not sure that's like a, one clear path of specifically for answering your question. But I think with the elements, or at least with the guidance, you can be doing those searches. And I think, some of the visualization or the kind of presentations that Sarah did on that can allow you to at least filter by those elements. So that would be my answer in terms of using still the recommendations. And I think in IATI there isn't a simple way of just using one single element in order to import that. But my question back to you would be: is it currently with our recommendation, is that possible for you to use those elements and still be able to import, or is that a barrier by having to kind of check in multiple places?
No, it's possible. I mean, we are working on the tool. It's possible. What we see is that it might lead to data that's not fully, because we depend on a string instead of a code list. I know that we cannot add a code list, or we cannot change the standard because it takes a lot of time, and this thing is happening and evolving every day. We can import it, and we will work on that. But we were thinking if it was possible, like to have a more systematized way of doing this, or doing like a clear path, like saying, okay, this is the way if the full activity is related to COVID. This is the way if only a couple of transactions. But what you're saying is that also makes sense that organizations can take time to adjust their way of publishing. So we need to find a balance, and we need to deal with that. We are like in integrating a lot of organizations which might not be able to adjust so quickly.
I would just say, I think it's great that you're doing that. I think my suggestion again would be, as I was saying, to very much keep updating each other. And I think having this mechanism of what you are already using, following the recommendations and how that develops, I think it's really important that we, don't stop that conversation, but actually, continue as we import data to share that feedback as well with those providing the data. And, if there are better ways that we can do that. But thanks for that.
No problem. Thank you.
Any other questions or raised hands or general feedback from people? Hi, Anna.
Hi, can you hear me?
Yes, we can hear you.
Yeah, hi. Just first of all, thank you very much for all your work on this. I think it's great that all these things are happening really quickly, and dealing with all the complexities. It's certainly not easy. I have a question on I would call it data quality in general, but because I feel like, okay, we know that it's difficult to control it because obviously IATI is a voluntary initiative, and it'll be hard for and we have been looking into, we as a community, into feedback mechanisms, but I wonder if for this specific piece of work, which is the COVID guidance is serving a specific purpose. I wonder whether the tech team or the secretariat are planning to take a bit of more of an active role in terms of data quality. So for example, if there is an activity that is clearly COVID related, and this is like an exaggeration, but if the publisher is not been using any of the recommended classifiers, or there are spelling errors, would this be something that the secretariat would consider, as in like targeting those publishers and improving the data quality just to make the data more useful in this case? So that was one consideration. In terms of the other questions, I raised it in the previous webinar and on Discuss, for me, like the issue around reporting repurposed funds, and I've suggested an option. But now also looking at the conversation around the first question on the quantifying percentages, I wonder whether if we consider the COVID for the development projects, if we consider COVID related activities as a sector, I think we could then classify, like we could quantify the amount of funding, because we can use percentages. So we can still use the OECD or other classifications and then add an additional sector, if that makes sense. I don't know if it's possible, but yeah, sorry, these were my questions.
Thank you very much, Anna, and yeah, for your contributions as well so far. So I think on the first one, I'll start and I'll see if anyone in the secretariat will want to add. But our plan very much is to engage with publishers, I think actively first around following those guidance recommendations, get involved as well more proactively with members. In terms of how you monitor that, again, I think this goes into, as you're aware, and for others, the kind of wider context of IATI and data quality, and what we are doing, not specifically for COVID, but more around use of validator. And at the moment, the COVID guidance falls within our recommendations and guidance. So we will actively encourage people to do that. In terms of monitoring how that's followed, I think as we look at data use, we can check that, but it's not something that can be made mandatory in the standards in that case. So if that answers your questions, I think we will proactively work with publishers and members to follow the recommendations, and then I think as we go along, we can encourage that even further. On your second point on repurposed funds and the sector, I think that for us is also, it is an option about using sector for percentages, with being able to specify percentages. And what we in the tech team, to be able to kind of model it, would be really useful to have kind of specific examples for organizations and from people. And so I would really call for people joining this webinar to very much work around use cases, because obviously I've spoken about a few options that theoretically can work. But it'll be really good to hear from you on kind of, I don't know, examples of 2 activities or so that we can kind of model and see if that works, the option of sector and quantifying percentages, and how that works with the real use case would be really, really helpful.
Thanks, Katja. I'll be in touch, because we probably have at least one example that of repurposing of funding. So I will probably send you an email this week.
That would be great. And just to say, those 2 discussions, obviously in this webinar we'll share all the information, but they're kind of active posts on Discuss as well. So we'll continue the conversation, and I'll just Annalise, I can see, I'll just unmute you. So if you want to add anything. Hi, Annalise.
Yes, hi. Thank you very much, Petja. That was a great presentation. Also to Sarah. Just responding in kind of general terms to Anna's question there, or Anna's comment regarding data quality. It's a broader thing, and as you know from our new strategy for 2020-25, we have really raised a focus on data quality to the same kind of level as we're looking at data use, and so we will be using this, you know, putting a particular microscope on how people are getting on with their publishing this COVID relevant data as we move forward with that. And one of the actions, as you know, that we will be taking up is establishing a working group specifically on data quality to work hand in hand very closely with the efforts going on data use. But as Petya has said, you know, we've been waiting to have our various tools built and ready, and our validator, and so that we will be in a good position to take advantage of these tools to assist our publishers very directly with helping them to improve their data quality. That was just a general comment in relation to how we're going to move forward with our strategy this year and how we will really focus on data quality.
Great.
Great, thank you. Thanks both.
Do we have any other comments from anyone, or questions or suggestions or data use cases? Mark, I'll just unmute you. Hi, Mark.
Hi there. Yeah, so thanks also for me for the very speedy turnaround and all the consultation work, and I think for the openness and engagement and everything on Discuss. So yeah, so as Sarah mentioned, I've been working on a little visualization of the COVID-19 response data for the Grand Bargain. And I just wanted to pick up on this question around, you know, accessing fields from different points, from different places, you know, different parts of the guidance. So for the visualization, we'll take the guidance from anywhere, from any part that's kind of been recommended as part of the IATI guidance. So yeah, just to reiterate, it'd be great if anyone is able to publish, you know, according to any part of the guidance within the next week or so, which is when we're looking to launch or share something a little bit more widely, at least in about a week or so. And yeah, I think there is a question around, you know, sort of having this kind of in several different places. And kind of, you know, especially, you know, doing something like this in future as well. And, you know, of course, it becomes harder to scale, you know, for more crises. But I think for now it's fine, because obviously this is quite like a sort of extraordinary kind of crisis. And I think it makes sense to try and find in some way sort of as many places as possible to capture this information in a way that, you know, basically lots of different publishers will be able to publish the data quickly, according to, you know, their own publishing practices and whatever limitations they have. So I think it's sort of quite a pragmatic solution for now to kind of recommend a few different places in which it could be done. And perhaps, you know, we can then revisit everything in you know, a few months, and look back at how this all worked, and if we can sort of collectively consider you know, a different solution in future. But I think for now it makes a lot of sense.
Thanks, Mark. I think that's really useful. And yeah, that was kind of my response about being pragmatic and being able to provide the recommendations. And I think it's really useful that you're already working on this, and I guess can also connect with, I think, Julian and his questions, and yeah, just share that with people already importing or trying to use the data. I think Tanaka, we have Tanaka raising her hand. Hi, Tanaka.
Hi there. Hopefully you can hear me. My Wi-Fi is a bit patchy. It was just a question with regards to donor communication of the IATI COVID guidelines, and whether or not they'd make it an addendum or guidelines for grant holders, just so that there's a more holistic approach of what's happening. Because I know anecdotally that there are some organizations considering how to publish this information, but they're just not quite clear as to if these guidance are like the single source of truth, or it will be cascaded by the donors. So if there's any clarification on that, that'd be really helpful.
That is a very good point and a really important one. I would say at the moment, I'm not aware of any additional changes, but it's something that we can definitely communicate and update the community on if that is added to kind of the donor additional. What Tanaka is talking about is the donor additional reporting requirements for others who might not be aware. So similar to the UK, Netherlands, Belgium, and so forth, whether that would be added. So I think on this, Tanaka, it's a very important point, and we can speak to donors and provide an update on how that works. But at the moment, that sits very much separate, and it is guidance and recommended recommendations for all IATI publishers. But very good question, so thank you for that.
Thank you.
Any other comments from anyone? Chat, I cannot see. Give it a few more seconds. I can't see any more hands or anything in the chat. Okay, I think in that case, maybe move on to the next slide on talking about next steps with this guidance. So next steps very much are call for you to have a look at the updated IATI publishing guidance on COVID-19. Obviously have a look and go through accessing or trying to access the data as what Sarah's already presented through Dport, our query builder. And our call is very much just, so get involved and share your feedback. This is not the complete end of the process. So do go on IATI Discuss. The three questions that you saw on the previous slides are on Discuss as kind of separate topics. So hearing from you, getting your use cases in order to guide our recommendations, it's extremely useful. And do get in touch with us at any time through the help desk. So in the tech team, we can get back to you. We would love to hear. And I think so far we've actually I've heard from quite a few people, and we really appreciate everyone's time and commitment to this. Quite excited that we can already see data available and people following the recommendations. But really important, I think, to keep the conversation and for you to reach out to us if you have any questions, and we can support you in any way.